So today we are going to discuss the topic on the general anesthesia, its introduction and some basic concepts of general anesthesia. So in earlier 14th or 13th centuries, the tooth extraction or removal of tooth was just like a barbarian procedure, which is done without any pain control, without any proper technique, proper instrumentation was not there, and not even proper sterilization was followed. So the primary importance for a best or better dental practice or dental surgery is always we should have a pain control. So coming on to the pain control, we should keep on mind the application of local anesthesia, the general anesthesia and conscious sedation. So these are the different levels of sedation. There is a minimal level is there, moderate level is there, this deep level of anesthesia is there, then the general anesthesia is there. So coming on to the history of anesthesia, in earlier time period, there were, especially in the 15th and 16th centuries, there were barbers who used to do the tooth extractions. It is done or achieved with the help of certain assistants. You can see in the picture how they are holding the patient tightly to have a control of the patient's reflexes to the tooth extraction and the pain. The pain will be there. They have to suffer from the pain. So later on, after a certain time period, they used certain snuffs of poppy or alcohol injection were given so that the patient will become unconscious. So in that unconsciousness, they will do the tooth extraction or whatever painful dental procedures. Later on, Horace Wells, so he is the first dentist who performed the tooth extraction with a good pain control with help of the nitrous oxide. And the word anesthesia is put forward by Oliver Wendell in 18th century, and it is derived from the Greek word athesis or without. It means the inhibition of sensation. Okay. So coming on to the basic concepts of general anesthesia. So this is the equipment which is used to deliver the general anesthesia. It is known as the Boyle's apparatus. You can see these are the contents or parts of the Boyle's apparatus. There is a cardiac monitor is there, which will regulates or which will give an idea of the different vitals or ECG levels. There is a rotometer is there, so it will give the level of ingestion of the oxygen, and it will calculate the titration values between the oxygen and carbon dioxide and the nitrous oxide present. There is a vaporizer is there. So in this vaporizer, the general anesthetic agents, especially the inhalational anesthetic agents, will be placed in these vaporizers, and the pressure gauges are there. Then in the left side you can see there is some tubes and bags. So this tubes, it will help to deliver the anesthesia towards the patients. In the right side picture you can see how the anesthetist is placing the anesthetic face mask towards the patient, and there will be a cart will be there where there will be placed the emergency endotracheal tubes, everything will be placed. So coming on to the general anesthesia, general anesthetics are drugs which produce reversible loss of all sensation and consciousness. It renders the patient, there will be loss of consciousness, loss of sensation. It will provide an analgesic effect. There will be amnesia and provide muscle relaxation, and all the reflex will be controlled. So these are the situations where the general anesthesia is indicated. A patient, if you want to work on a patient or want to do a surgical procedure on a patient under the age of 4 years of old, complex medical pathologies which is happening in the respiratory system, renal system, intracranial region, or any epileptic conditions, physical and mental limited incapacities, necessary of extensive treatment, long surgical treatments, emergency treatments, inefficient local anesthesia treatments, when there is extreme phobia and anxiety, and we can go out for a general anesthesia procedure in case of a ASA 3 patients or higher. ASA 3 in the sense means the patient will be having some or one or the other kind of systemic risk to do under a local anesthesia. Coming on to the contraindications of general anesthesia, there is lack of adequate training by the doctor, lack of trained personnel, lack of equipment. So inadequate training and equipment, if it is available, we can't go ahead with the general anesthesia. So this is the Giddle's classification which we will follow for the application of general anesthesia. There is 4 stages. In stage 1, stage of analgesia is there. Stage 2, stage of delirium. Stage 3, stage of surgical anesthesia. Stage 4, there is medullary paralysis. In stage 1, stage of analgesia, which will be starting from beginning of anesthetic inhalation, last up to the loss of consciousness. In this stage, the pain will be progressively diminished and the patient will be having a slight amnesia effect. Most of the minor procedures we can do it, and better to do it under this stage. In stage 2, that is a stage of delirium, there will be a loss of consciousness, beginning of regular respiration, and the patient may shout, struggle, there will be increase in muscle tone, breathing will be jerky, there can be a chance of vomiting, and due to the excessive reflex there can be increase in heart rate and blood pressure, pupils will be dilated. Stage 3, this is the stage of surgical anesthesia. In this stage, onset of regular respiration lasts, and in this stage there are 4 planes. In first plane you can see the patient having a roving eyeballs, there will be loss of corneal or laryngeal reflexes, and in stage plane 3 there will be pupil start dilating, and intercostal muscle paralysis can happen in the last plane of this stage. And stage 4, it's a final stage, there can happen a medullary paralysis in case of cessation of breathing, which can lead to failure of circulation and death can occur. So it is a final stage. At the end of the stage, the pupil will be starting dilated and BP becomes low. Coming on to the classifications of general anesthetic agents, there is inhalation anesthetic agents are there and intravenous anesthetic agents are there. In inhalation anesthetic agents, there is gaseous agents are there. Most commonly used is nitrous oxide, and volatile liquids are there, such for example ether, halothane, enflurane, desflurane, sevoflurane. Most commonly used is sevoflurane nowadays. And intravenous anesthetic agents, there is some inducing agents are there, especially thiopentone sodium, methotrexate sodium, propofol, etomidate. And in slower acting drugs, there is diazepam, lorazepam, midazepam, and opioid analgesic, there is fentanyl is there. And a set of inhalational anesthetic agents as nitrous oxide, it is the most potent analgesic but a weak anesthetic. Most commonly in dentistry nowadays, preferably used for pediatric patients for different procedures like pulpectomies and all, which can be done under local anesthesia, but the analgesic effect and amnesia can be helpful with the help of the use of nitrous oxide. And certain minor oral surgical procedures, patient who is having anxiety, we can go ahead with the nitrous oxide inhalation. It's a poor muscle relaxant. It should be titrated and given as required according to a specific time. Mostly if the procedure will be taking 1 hour, we can go ahead with a nitrous oxide is very much safe. The patient is having anxiety and fear on the procedure. Coming on to the set of intravenous anesthetic agents, generally the induction of anesthesia, which will be done just before the inducing, that is the intubation of tube to the delivery of the anesthetic agent towards the respiratory system. Just before that, we can give an intravenous anesthetic, and most commonly used is propofol. It is supplemental with analgesics and muscle relaxant. The vecuronium and the propofol are the 2 commonly used drugs just given before the inducing. Coming on to the advantages of general anesthesia, patient's cooperation is not absolutely essential for the success of general anesthesia. Patient is unconscious and does not respond to pain. The amnesia will be present. There will be rapid onset of action. And disadvantages of general anesthesia: the patient is unconscious, protective reflexes are depressed, the vital signs are depressed, and the anesthesia team is required for, and special equipment, the recovery team area, intraoperative complications, that all can occur. So coming on to the conscious sedation, so as I told, in dentistry practice nowadays, the painless, fearless dentistry is practiced. So conscious sedation is very much helpful in the application of those kind of procedures. Nowadays, the patient, especially the pediatric, as I told, is having very much fear and anxiety for the procedure. And certain adults also, they will be having, for particular procedure, they will be also having a fear and anxiety. So these can be used. So this conscious sedation procedure can be used in this kind of procedure. So conscious sedation is a minimally depressed level of consciousness that retains patient's ability to maintain an airway independently and respond appropriately to physical stimulation and verbal command. So with this sedation, the patient will be responding to the physical stimulation. If you are telling them to raise the hand, they will be raising the hand. If you are asking their name, they will be responding. The proper verbal command and physical response will be there. So coming on to this objectives, it's a Bennett's classification. So the patient's mood should be altered, child's pain threshold should be increased, amnesia should occur, patient should be cooperative, patient should be conscious, all protective reflexes are intact, vital signs should be so within these objectives are possible, then only we can give a conscious sedation. And coming on to its indication, as I told, the dental anxiety, the fear, phobia, prolonged or traumatic dental procedures in both the pediatrics and the adults are afraid of certain medical conditions, especially the mentally retarded situations, special childs, patient lacking cooperation, and contraindicated, especially as these conscious sedation, inhalational anesthesia, all are the game which is happening related to the respiratory system. So if any diseases such as like chronic obstructive pulmonary disease or any kind of epilepsy or bleeding disorders, then the conscious sedation is contraindicated. We have to go under the general anesthesia. Some uncooperative or unwilling patients, as you all know, the physical response and verbal command, everything will be awakened. Only the patient will be having a slight analgesia and amnesia. So uncooperative patient is not a good candidate, and unaccompanied patients also we can't go ahead. A prolonged surgery procedure which is taking more than 1.5 to 2.5 hours, we can't go for a conscious sedation. Lack of equipment or emergency drug is not available, we can't go ahead also. So these are the requirements before using the conscious sedation. There should be a proper medical case history, the previous dental history should be there, and all the instructions pre-operative, post-operative to be told to the patient as well as the bystander, and all vitals, everything should be checked before and in between the procedures. A written document for consent for sedation should be there. Pre and post-op assessment also should be done. So these are the preparation for sedation procedure. There should be a proper oxygen presence should be there. The airway should be appropriate with the help of which we can achieve with the help of a face mask. In case of emergency, we have to go for the endotracheal tube. All basic emergency drug kit should be present. A cardiac monitor which evaluates the vitals and especially the heart rate, respiratory rate, the ECG should be present there. And in case of emergency, special equipments like defibrillator should be present. Then coming on to the sedative techniques, there is inhalational sedation, oral sedation, intramuscular sedation, intravenous sedation, and rectal sedation is there. So oral sedation is ideal where it is not possible to use one of the titratable techniques. The oral sedation should only be used by the help of IV cannulation, and diazepam is the best option. So this is how pediatric will be when we place inhalational mask for for a nitrous oxide sedation. So there will be desirable property. It will be having an analgesic amnesia property, and recovery will be there. So these is the pharmacokinetics which is happening, means the exchange of gases between the pulmonary membrane, and as it is a indissolvable or insoluble drug, it won't mix up with the bloodstream. Okay, so once it goes towards the body, it will be eliminated by the lungs itself. So we can titrate by the help of oxygen. You can increase the oxygen value, so all of the nitrous oxide will be washed away. It won't get mixed up with the bloodstream. Coming on to the technique, recline the patient with leg crossed and position the mask over the patient's nose. Close the air entrainment valve on mask. So initially we will be delivered 100% of oxygen towards the patient. Later on we will be titrating the levels of oxygen lower. We will be titrating to 95%, then 90%. With that, subsequently we will be increasing the nitrous oxide values. So initially it will be 5%, then it will be 10%. So in adults usually we can go up to 25 to 30% of nitrous oxide, and the remaining will be cope up with the oxygen level. So mostly in pediatrics the levels will be managed like 5 to 15%. Adverse effects post-operatively, there can be a chance of nausea, vomiting, mid-ear pressure or increased pain in patients. There can be diffusion hypoxia. In increased levels, there can be chance of neurotoxicity or liver toxicity. So coming on to the intravenous or IV technique, which is mostly performed as a part of general anesthesia and in some minor procedure also, especially in long-term procedures like multiple implant placements or multiple impacted tooth removal, we can go ahead with the intravenous sedation technique. And midazolam is a choice of drug which we can give. The values will be 0.5 to 1 milligram. And this is another Jorgensen technique which we use 3 drugs for intravenous sedation: pentobarbital, mepridine, scopolamine. And chain technique is another technique where again we will be using 4 drugs combining, which will be giving a better intravenous sedation. So coming on to the difference between the conscious sedation and general anesthesia. In conscious sedation, patient is cooperative but anxious and fearful. In general anesthesia, patient is uncooperative, and conscious sedation, generally no extensive investigations are required. When the patient step into your OPD, you can, if the patient is having fear and anxiety towards your procedure, you can directly go for a conscious sedation and do the procedure. And general anesthesia, we need a pre-anesthetic check for that, and no pre-medication is required for conscious sedation, but there is a set of 7 pre-medication which will be given prior to the procedure. And conscious sedation, patient is conscious, contact is maintained, physical response, verbal response will be there. General anesthesia, patient will be completely unconscious. Airway is maintained in conscious sedation. Ventilation is required for a general anesthesia. NPO is not required for a conscious sedation. Strict NPO, nil per oral, should be followed 7 hours, 6 to 7 hours before the anesthesia. And recuperation time period is like 1 to 2 minutes you can achieve a conscious sedation, but general anesthesia, there is a set of steps initially we have to follow. So minimum of 20 to 30 minutes for achieving a general anesthesia is required. Thank you.